Welcome back to Metta Health Talk. Whenever a highly mutated COVID-19 variant emerges, the first question on everyone's mind is, will this make me sicker, and does it feel different from the variants I caught in the past? With the rapid global spread of the new BA.3.2 Cicada variant, scientists and doctors have been closely monitoring clinical reports to answer exactly that. The Cicada variant has between 70 and 75 mutations on its spike protein, making it genetically distinct from the JN.1 and XBB strains that dominated 2024 and 2025. Because the virus has changed its physical structure so drastically to evade our immune systems, the way it interacts with human cells has also shifted. Today, we are going to look at the exact clinical profile of the BA.3.2 variant. We will examine the most prominent symptoms patients are reporting right now, explain which classic COVID-19 symptoms have almost completely vanished, and dive into the biological reasons why this heavily mutated virus is acting more like a severe cold and less like the deep lung pneumonia we saw in 2020 and 2021. If you are infected with the BA.3.2 Cicada variant today, your illness will likely present as a mild to moderate upper respiratory infection. According to the CDC and frontline infectious disease specialists, the hallmark symptoms of this specific lineage are highly concentrated in the head, neck, and upper airway. The most common baseline symptoms include nasal congestion, a persistent runny nose, mild to moderate fever, usually lasting only 24 to 48 hours, and body aches. In many ways, the initial onset feels identical to a standard seasonal rhinovirus or influenza. However, there is a notable rise in gastrointestinal symptoms with the Cicada variant, particularly in younger patients. Clinical tracking shows that up to 42% of symptomatic patients are reporting issues like nausea, mild diarrhea, and a sudden loss of appetite alongside their respiratory symptoms. While previous Omicron subvariants also caused stomach issues, BA.3.2 seems to trigger these symptoms slightly more frequently during the first few days of infection. While the baseline symptoms resemble a common cold, doctors have identified two standout symptoms that are currently defining the BA.3.2 clinical experience: a uniquely painful sore throat and profound fatigue. Nearly 88% of patients infected with the Cicada variant report a severe sore throat as their very first symptom. However, patients describe this not just as a typical soreness, but as a distinct scratchy or burning sensation. Many report feeling as though a sharp object is scratching the back of their throat when they speak or swallow saliva. This intense throat pain is often accompanied by a dry, hacking cough that lingers even after the fever breaks. The second defining feature is extreme physical and mental fatigue. Even after the acute respiratory symptoms begin to fade, patients are reporting persistent tiredness and brain fog. This profound exhaustion can last for days or even weeks after the patient tests negative, setting it apart from the quicker bounce-back times seen with milder, earlier Omicron sublineages. Just as important as the new symptoms are the old symptoms that have faded away. If you remember the original COVID-19 outbreaks, particularly the Alpha and Delta variants in 2020 and 2021, the absolute defining symptom was anosmia, the sudden, complete loss of taste and smell. With the BA.3.2 Cicada variant, this symptom has almost completely disappeared. Current clinical data indicates that less than 5% of patients infected with BA.3.2 experience any loss of their olfactory senses. If a patient does experience a diminished sense of taste or smell, it is almost entirely due to severe nasal congestion blocking the sinuses rather than the virus directly attacking the nerve endings in the olfactory bulb, which is what the earlier variants did. We also see far fewer reports of shortness of breath and severe chest pain. In the early days of the pandemic, hypoxia, low blood oxygen, was a primary warning sign. With BA.3.2, unless the patient has a severe underlying lung condition, dangerous drops in oxygen levels are incredibly rare. Why are the symptoms of BA.3.2 so different from the variants of the past? The answer comes down to cellular biology and the 75 mutations on the virus's spike protein. To survive and spread, the Cicada variant had to make a biological trade-off. Laboratory studies have revealed that while these massive mutations allow BA.3.2 to evade our antibodies, they also change how effectively the virus can bind to human cells. Specifically, BA.3.2 replicates at an astonishingly fast rate in the tissues of the upper respiratory tract, meaning the nose, mouth, and throat. This rapid replication in the throat is exactly why the burning sore throat is so common, and why the virus spreads so easily when someone talks or coughs. However, the trade-off is that BA.3.2 is far less efficient at infecting the alveolar cells deep inside the lungs. Previous variants like Delta thrived in the deep lung tissue, which is what caused massive inflammation, pneumonia, and acute respiratory distress syndrome. The Cicada variant struggles to penetrate that deep, which is why it generally causes an aggressive head cold, rather than a life-threatening lung infection. To summarize the clinical profile of the BA.3.2 Cicada variant, it is a highly mutated strain that has successfully adapted to bypass early immune defenses, but it has not evolved to become more lethal. If you contract this variant, you should expect an intense, scratchy sore throat, a few days of congestion and mild fever, and a lingering sense of fatigue and brain fog. You might experience some stomach upset, but you are highly unlikely to lose your sense of taste or smell, and you are very unlikely to develop severe pneumonia. Because the symptoms remain generally mild for the vast majority of vaccinated individuals, treatment is focused on supportive care at home. Rest, aggressively hydrate, use throat lozenges or anti-inflammatory painkillers for the severe sore throat, and allow your body the time it needs to clear the extreme fatigue. As always, high-risk individuals should test early and contact their healthcare provider to access antiviral therapies, which remain highly effective against BA.3.2. Thank you for watching Metta Health Talk, and please subscribe for more science-backed medical updates.